Hello, this is Taekyung Kim. Today I'd like to talk about Lyme disease and the mental or psychiatric problems. Lyme disease is a bacterial infection by Borrelia. It can be best treated in the early stages. Treatment for early localized disease is a simple 10 to 14-day course of oral antibiotics to eliminate the infection. It normally takes 28 days to 3 months to get rid of the infection. If people are treated for Lyme disease with antibiotics but continue to experience symptoms, it is referred to as post-Lyme disease syndrome or post-treatment Lyme disease syndrome. About 10 to 20% of the people with Lyme disease experience this syndrome, but doctors and scientists still do not clearly know why. From time to time, Lyme disease has been linked to mental or psychiatric problems. These can include difficulty sleeping, anxiety, depression, irritability, and higher sensitivity to sound and light. In more severe cases, Lyme disease may have some connections to paranoia, obsessive compulsive disorder, hallucinations, or schizophrenia. All those mental or psychiatric problems seem to be due to the inflammation on the brain tissue. The inflammation on the brain tissue can be caused either by an infection invading the brain, which is called an infectious encephalitis, or by the immune system attacking the brain in error. In case of Lyme disease, the inflammation on the brain tissue seems to be caused by the confused immune system. This is also known as post-infectious or autoimmune encephalitis. The people who have post-Lyme disease syndrome can have mental or psychiatric issues due to the error of their immune system, which is massively shocked by the bacterial infection. This huge shock caused by the bacterial infection makes their immune system confused and become hypersensitive. Therefore, it starts to overreact excessively. As a result, it can cause a high level of inflammation everywhere in our body. When the brain tissue gets inflamed, people who have Lyme disease start to suffer from many kinds of psychiatric symptoms. Normally, the Lyme disease sufferers who have mental or psychiatric symptoms also have high level of inflammation on their digestive tract. Actually, inflammation goes on everywhere in our body. To reduce this high level of inflammation on the brain tissue, first of all, people should follow the specific group of diet for their own body type. We 8 constitutional therapy practitioners divide all the human beings into 8 different body types according to their own individually distinctive internal organs dynamics. When people eat the right diet for their own body type, all their internal organs are well balanced, and these optimized internal organs are working their best. This can maximize the healing potential of our body. Second of all, people should eat each meal on time and the same amount every day. This makes the stomach strong. The stomach is the first line of the nutritional factory of our body. Therefore, when the stomach gets stronger, then people can absorb more nutrition from what they eat. This can accelerate the healing process. Third of all, people need to have a regular treatment session. According to my clinical experiences, 8 constitutional acupuncture seems to be the best treatment method, specifically for the mental or psychiatric symptoms. Intensive steroid treatment does not seem to be ideal because it can cause more troubles. Keep in mind, please. Thanks for watching this video.